Today we'll be looking at the implementation of a MAPP setup to help decrease STD rates in Douglas County, Nebraska. As you can see from these graphs, STD rates in Douglas County are much higher than both the national average and the state average. These rates have been higher than the national average since 1998 and have seen large spikes, especially from 2017 to 2018. Looking at these graphs, you can see the dire need. To give an overview of the demographic within Douglas County, the median age is about 35 years old, with 62% of the population being between the ages of 18 and 64. There's a pretty even split between gender, with 49% being male and 51% being female. 7% of the population live below the poverty line. Looking at race and ethnicity, it is a predominantly white demographic with 69%, followed by Hispanics making up 13%, Blacks making up 11%, and Asians making up 4%. So how do STDs impact the community? The answer to that question is really looking at the quality of life, both at the individual level and at the environmental level. So at the individual level, those who have contracted an STD may feel a negative stigma towards them. They may see fetal and perinatal reproductive health issues. There is an increased risk of cancer and a possibility of infertility if left untreated. Now, looking at the environmental impacts, increased healthcare costs can be felt by everyone in the community. Racial and ethnic inequalities and gender inequalities can both be seen in STD rates. After vigorous research of what other counties have found to be successful in implementing positive change in their communities, the Douglas County Health Department has recommended the use of the Mobilizing for Action Through Planning and Partnerships, or MAPP. According to the National Association of County and City Health Officials, MAPP is a community-driven strategic planning process for improving community health. The goal of MAPP is to establish key community stakeholders who are already working to combat the issue at hand and provide an area where collaboration can occur, pooling resources, and making a larger and more sustainable impact. The use of MAPP will benefit all in the Douglas County region by offering resources to all people, regardless of status, gender, or ethnicity. The Douglas County Health Department has deemed these levels an epidemic and needs help from everyone in the community. The first phase of implementing a MAPP program is organization. As you can see here, a list has been made of key stakeholders in the Douglas County area who are already working to help decrease STD rates. On the right-hand side, you can see the resources that would be needed to effectively implement the MAPP process. This MAPP will seek to utilize an advisory visioning process due to low funding and wanting to spend most of the funding on materials. Additionally, Planned Parenthood and Get Checked Omaha are both excellent sponsors who will be providing much needed support and supplies. Due to this process, Douglas County Health Department envisions a decrease in STI rates to drop below national rates. This large task will be successful with a multi-level prevention program set to reach the entire community. The community will be constructed of health professionals from a variety of backgrounds to establish a strategic plan and see the program through to its completion. Next is the assessment phase. So we already looked at the demographics collected for Douglas County and the impacts on quality of life. After assessing the current situation in Douglas County, it is recommended that improvements to the public's health must occur by partnerships between the Douglas County Health Department and the community partners to increase awareness, reduce barriers and stigma around STD testing, and make condoms and STD testing more available. The Douglas County Health Department can distribute educational materials and host STD testing, along with providing resources to the community and other stakeholders. Local hospitals and clinics can help the STD testing and sex education. Local schools can offer health education for both students and parents at multiple levels. Assisted living communities may often be overlooked, so services should be provided to the residents as well. Lastly, Get Checked Omaha provides a list of testing sites and events across the community, as well as educate people and work hard to change the stigma around condom use and STD testing. Finally, strategies, goals, and actions are set in place to ensure that the implementation of this MAPP process is successful. Here, they have identified 3 issues, give goals for how they will address those issues, and strategies for how they can reduce those issues. Thank you.